Welcome back. So this time we'll talk about another cause of vaginal discharge, which we call aerobic vaginitis. What we mean by this aerobic vaginitis is that a woman transfers some of the organisms, the aerobic organisms that should be living in the anus and rectum into the vulva. She does this while cleaning her anus after passing stool. She cleans from the back to the front, or even clean the anus without cleaning properly, and those organisms move maybe with sweat into the vulva area and now cause inflammation of the vulva and the vagina. So the woman will come down with abnormal vaginal discharge that is foul smelling. There may be burning during urination. There may be excoriations and other discomforts in the vulva area. And sometimes some women will tell you that after passing stool in a public toilet that they had the discharge, that they got it from the toilet, that is toilet infection. Not knowing that it is due to their own poor personal hygiene, that they moved those organisms or they did not clean their anus properly, and those organisms moved from the anal region to the vulva area. So they cause what we call aerobic vaginitis. The treatment is different from what is obtained in the other types of abnormal vaginal discharge. So anybody that has aerobic vaginitis and is taking medications for candida or gardnerella or trichomonas may not even be doing justice to herself. So it is important to give clear history of how the problem is so that the doctor will understand exactly what is happening to you and treat you appropriately.